Good afternoon, Carrie. It's good to see you. Thanks for coming in today. And I want to express my condolences on the loss of your father. He was such a wonderful man.
Thank you. He was.
Yes, he was. I hope the conversation this afternoon will be helpful to you. I wanted to have everyone introduce themselves. Doctors, would you like to introduce yourselves?
Hi, I'm Dr. Kumar. You may remember me from your father's first day during his stroke. I'm one of the neurologists who had the privilege of caring for your father. He was one of my most memorable patients. We found that we shared a love of attending the symphony,
Yes.
and we discussed a few of the latest programs at the BSO.
Yeah, he never missed a show if he could help it.
Hello, I'm Dr. Lauritsen, and I'm the Vice Chair of Radiology. We haven't met before, but it's part of my job to help determine both what went wrong in following up on your father's x-ray and also how to improve the way we do our work so that this doesn't happen again. And while I never met your father personally, I know my team members had great respect for him, and I want you to know that I take my responsibility to correct these issues with radiology follow-up extremely seriously.
Thank you.
And you know Lynn? Yes.
Hi, Lynn.
Hi, I'm Lynn. We met before. Nice to see you again.
And this is Mr. Hansen, an attorney for the hospital, and of course your attorney, Ms. Smith. So thank you for being here today. I'd like to start off the meeting today just really by reaffirming the most important thing, which is that we are so sorry that this misoccurred on our part and for the heartbreak it's caused you and your family. I want to let you know that we were able to understand things a little better after doing our research into this event, but I first want to check in with you to see if there's anything in particular we can answer for you right away.
Not at this time.
Okay, great. So I think it would be probably helpful for you to understand a little bit more about the clinical situation. So Dr. Kumar
Yes.
is going to explain that.
Sure. When your father originally came into the emergency room 2 years ago, he was very sick. As you know, he had a stroke, and I had to address that very urgently, or he could have died right then. We were very focused on his care around this, and so we were not aware that a chest x-ray had been ordered due to his complaints in the emergency room about his cough. It was not something I myself ordered, and so in order to communicate studies or x-rays ordered by other physicians, we have an electronic medical record that alerts us to these other studies. We realized in looking at your father's care that we need to do a better job communicating when studies are ordered in the emergency room that are outside the scope of the urgent problem. I didn't realize your father had other complaints not associated with his stroke, and as a team, we need to do better communicating in other ways aside from the medical record. When the radiologist, the doctor who reads the x-rays, reviewed your father's chest x-ray, he noticed there was an area of the lung that was concerning to him, and so he put a flag on the x-ray to alert anyone reading your father's chart that there was a need to follow up with this. While the flag was there, the next issue we found in review was the x-ray was not mentioned in the discharge summary, which is written to give doctors caring for the patient at a later time a way to see at a glance what happened to the patient in the hospital and what still needs to be done. This shouldn't have happened. The x-ray results should have been mentioned during the discharge summary so that other doctors and you and your father would know this was important to follow up on.
You know, I don't understand how you could miss that. And you know, I was looking at his online record and I didn't see anything. I don't understand how you miss a flag if a flag's for something important. If that's the way to alert people, how are you going to make sure nobody misses another flag?
Well, that's a great question, and we've been asking ourselves those same things. So we did have some things in place to try to prevent this, but we discovered that they clearly weren't thorough enough. And we know that since it's a human being's job to write a discharge summary, sometimes things do get missed. And unfortunately, this does happen from time to time as doctors have many patients and there are lots of discharge summaries to write. So as the vice chair of radiology, it's my job to help create systems that prevent misses like this. And because we know that people aren't perfect and they do make mistakes. Now, we did have a computer system in place called Radar, but we noticed during this review that our Radar system didn't have a wide enough range of words to look for in order to automatically flag them, as Dr. Kumar mentioned. So we've now added more words like mass to the system to be able to make it better at identifying needs that may be missed by human beings.
I just still don't understand how this could be missed. It seems incomprehensible that something like a mass could be.
I understand.
I as my father's daughter, I just assumed you people talk to each other. I didn't know.
We do talk to each other, but we also do have backup systems in place. Now, as a radiologist, I see many patients' x-rays, but I never meet them directly. And the patients' doctors that see them face-to-face and manage their overall care take my findings from the x-rays, and then those doctors decide how to proceed. But it's part of all of our jobs to make sure that the transfer of the responsibility around the follow-up on x-rays is accepted and that there's a specific plan in place. Now, this was also one of the issues that we uncovered from your father's situation. So now what we've done is that we've developed a new system which requires the original doctor whose patient had a flag result to be responsible for the transfer of that follow-up to another provider in a very specific way. So the original doctor must create a follow-up plan which requires an appointment to be made with a specialist who will then be responsible for further exploring that flag result. Now that plan will be entered into the computer system so that the follow-up's clear to everyone, both the specialist and the primary care provider for the patient. That way, the primary care provider and the specialist will be alerted if there's any missed follow-up appointments and they can address them. Now, I understand that these improvements didn't help your father, but I want to make sure that this never happens again. And I do hope that it helps you understand more about what happened and how seriously that we are taking this.
Well, that's good to know, but as you know, it doesn't help him. But I'm glad no other family has to go through this again.
And we want you to know that we are trying to learn from this experience and we are trying to fix these failures.
Yeah.
Like I said, it doesn't help us now. We're glad you're being honest. But we lost our dad. We're missing a big part of our family now. My kids don't get to know their grandfather. My brother's kids don't get to know their grandfather. My mother lost her best friend and partner. I mean, it's had our family has a hole in it, and we appreciate this, but it's not going to make him come back. And 2 years of lost time, I wonder if we knew about it earlier, if we could have had some great quality time, because the last 2 months have been, the last couple of months of his life was painful to watch the man become a shell of himself. We trusted you, and you failed, and now my father's gone. And we might never know if he'd still be here if we caught this earlier.
And I'm so sorry. I know we can't bring your father back, but we do want to do right by you in the best we can under these circumstances. It is our responsibility to do that. As I mentioned to you before in one of our previous conversations, we use communication, apology, and resolution. And the reason we do that is because we feel like that is the right thing, that we would all want that if we were patients and something were to go wrong. We want to be honest about our mistakes, prevent them from happening again, and support you and your family. And one of the ways that we do that is by having our insurer take a look at what happened here in this clinical situation and make an assessment of possible compensation for you and your father and all that he suffered and your family has suffered. What do you think about that?
It feels like I'm making money off of my father's death, and that's not what it is. I mean, it would be nice to have money to help take care of my mother's needs, since my brother and I are not able to. That would be helpful, and I know that would mean a lot to my father to know my mother was taken care of.
Of course, of course. And I don't want you to think of it at all as profiting from something terrible that happened to your father. It's things that you need and deserve. And this shouldn't have happened, and it's our responsibility to make that as right as we can.
Thank you. What do you think?
Yeah, I think you should proceed. I think they've shown today that they're making, a good effort of good faith, so I think it's okay to do the same.
Great. Okay, so I'll put you in touch with the claims representative at CRICO. Carrie, is there anything else that you want to know about or you want us to know today?
Can you use my father's case to as a learning tool for others, so that as you're fixing the systems, they can know that these are the consequences when things get missed?
Yes, absolutely. And actually, his story has already been used in a lot of the different departments that we went to talk about what has happened and who he was and why this really mattered a lot. We also have a lot of opportunities in the future to do this. So when we have new residents coming into our facility, new physicians that are joining us, we want to use examples like this to show them that these are people that they are caring for, and that we want to all be very vigilant about how we are caring for our patients. So we will continue to do that. But I would love to have you work with us if you think of any other ways that you might want to have his story shared that would be effective, because we think that would be very valuable as well.
I think if my father were here, he would be happy to know that it was being used to save others from going through the same thing.
Good. Okay, great. Well, we can definitely do more of that and continue to do that. So
thank you. We appreciate the kindness and the empathy that you've all shown me and my family. We appreciate it. And I didn't realize until I had done some reading that this communication and apology thing you're talking about wasn't always done. Mm-hmm. So knowing that now, I really appreciate the fact that you are being open and honest with us.
Well, it's the least we can do. And again, we're so sorry.
And I would love to share with you, if it's at all helpful, or support for patients and families. It's called the Patient and Family Peer Support Network. It's out of the Betsy Lehman Center, so it's a state agency, so it means the support is completely free. It's meant to support patients or families who are going through something like what you're going through. So the way it works is that they will match you with a patient or family member who knows what it feels like to experience what you're going through. I have a brochure here that can tell you more information about how to get connected.
I would love that. Thank you very much. Thank you. Appreciate it.
Well, if there's nothing else, we just really want you to know how deeply sorry we are, and that this has changed the way that we work here at the hospital. If you need anything else or you think of anything, please, again, feel free to have Jane reach out to us, and we are happy to help.
Okay. Thank you.